Hey there everyone. In the previous video of anatomy, we had studied the back of thigh. Okay, we have studied the chapter the back of the thigh. We saw the deep fascia, the superficial fascia. We saw all the contents, the sciatic nerve, origin, root valve, course, termination, branches, common peroneal nerve, and anastomosis, that is cruciate anastomosis, trochanteric anastomosis, longitudinal anastomosis, everything. So in this video we are going to cover only the muscles of the back of thigh. Okay, so the muscles of the back of thigh, they are commonly called as the hamstring muscles. Okay, they are called as the hamstring muscles. Okay, hamstring muscle. So the muscles are biceps femoris, semitendinosus, semimembranosus. The biceps, as the name suggests, it has two heads, a long head and a short head. Okay, and we have one more muscle, that is the adductor magnus muscle. If you haven't checked out my medial side of the thigh chapter, please go check out that video. I will link it out in this description box. So adductor magnus, it is a hybrid muscle. Okay, it is a hybrid muscle, and it is a muscle that belongs to both the compartments. Okay, both the compartments. Okay, suppose this is the anterior compartment, this is the posterior compartment, and this is the medial compartment. So the adductor magnus, it is a muscle of both the compartments. It is a component of both the compartments, that is the medial side as well and the posterior side as well. Okay, so the medial side of the thigh and the back of the thigh as well. Okay, and it is a hybrid muscle. Hybrid, what do you mean by hybrid muscle? A muscle that has dual nerve supply or dual nerve innervation. Okay, so it is a hybrid muscle. So it is present in both the compartments, as I already mentioned. It is on the medial side and also in the posterior side. So the adductor magnus, it has two origins. The adductor, it has two parts, the adductor part and the hamstring part. Okay, we will see about that in this video itself later. Okay, so see, this is the biceps femoris. It has two heads. We have the semitendinosus means semi, half. Okay, and tendinosus, okay, tendon. Okay, tendon is there. Okay, so the muscle, it is mostly tendinous. Okay, and semimembranosus, membrane, it is like a membrane. This muscle is like a membrane. So semitendinosus, semimembranosus, biceps femoris, these are the hamstring muscle. And one more muscle, that is the adductor magnus muscle. Okay, the hamstring part of the adductor magnus muscle. Okay, so let's see the common origin of, not common origin, but origin of these muscles. Okay, on the hip bone, okay, on the hip bone we have this is the posterior side, the posterior surface of the hip bone. We have the semimembranosus on the top, so this is the semimembranosus muscle. Then long head of the biceps femoris. Okay, long head of the biceps femoris, this is the adductor magnus. Okay, ischiocondylar portion. So this is the adductor magnus, and the again adductor magnus, as I already told, it has two branches, right? This is on the posterior side and this is on the anterior side. So semimembranosus and adductor magnus. So, okay, these are the origins. Now we will see okay, first we'll see this. Okay, the semitendinosus muscle. Let me change the color. The semitendinosus muscle. Okay, half of the muscle is tendinous in nature, so that is the reason its name is semitendinosus muscle. So origin is on the ischial tuberosity of the hip bone. Okay, this is the ischial tuberosity on this part. So this is the ischial tuberosity, this is the origin, and insertion is on the proximal tibia. Okay, it is on the tibia bone, medial to tibial tuberosity. Okay, the tibial tuberosity, medial to the tibial tuberosity part of this is not required. Okay, on the medial tuberosity of the tibia. So origin on the ischial tuberosity and insertion on the tibial tuberosity. Ischial tuberosity and tibial tuberosity. See, T is there in this right, T is there, T letter is there in this name. So T for tibial tuberosity and ischial tuberosity. Okay, tuberosities, two tuberosities, that is the ischial tuberosity and tibial tuberosity. Okay, proximal on the which tibia. Okay, insertion is on the tibia, and the nerve supply is by the tibial part of the sciatic nerve. We have already seen in detail about the sciatic nerve in the previous video. I'll link that out in the description box, please check that out. So on the superior angle of the popliteal fossa, the sciatic nerve, it bifurcates. Okay, so this becomes the tibial part and this becomes the common peroneal part. Okay, so nerve supply is by the tibial part of the sciatic nerve. Tibial part, again see semitendinosus में T आ रहा है, right? T. So can remember it like T cube. Okay, tuberosities, two tuberosities and one nerve supply by the tibial part of the sciatic nerve. So we'll see the plexus once again. So see, this is the tibial nerve by L4, L5, S1, S2 and S3. So 5 root values, and for the common peroneal we have only 4, that L4, L5, S1 and S2 only. And the peroneal is on the posterior or the dorsal side, and then tibial is on the anterior side. Okay, so C, P for peroneal, P for posterior. Okay, all dorsal, it's easy to remember. So we are done with the nerve supply. Now what is the action? Chief flexor of the knee and weak extensor of the hip. Okay, this is common for most of the hamstring muscles. Okay, and medial rotation also. Okay, it helps in the medial rotation of the medial rotation also. Okay, so see, it is a chief flexor of the knee. Okay, flexor, because posterior compartment is the flexor compartment, so it is flexor at the knee joint, and extensor of the hip, extensor of the hip and flexor of the knee. Because see, flexion, oh no, इतना ज़्यादा भी नहीं, तो see this is इतना भी नहीं भाई. So see, okay, so this is the hip and this is the knee. This is flexion and this is extension. Of course जब flexion होता है तो ऊपर की साइड पे extension होता है, and ऊपर की साइड पे अगर extension होता flexion होता है तो पीछे की साइड पे, नीचे की साइड पे opposite, it works opposite. So it is flexor of the knee, chief flexor of the knee and weak extensor of the hip. Okay, it is common for almost all the muscles of hamstring muscles, all the hamstring muscles. Now we'll see the semimembranosus muscle. Okay, half of this muscle is like membrane, so it is semimembranosus by the name we understand. The origin point, so the ischial tuberosity. Okay, ischial tuberosity, again this is on the ischial tuberosity, and insertion is on the posterior medial condyle of tibia. Okay, posterior ke side pe. So see, this is the posterior surface. Okay, this is the posterior surface, and we know that this is the popliteal surface of the femur. So this is the posterior surface and this is the medial condyle of the tibia, medial condyle of the tibia. So it is getting inserted here. So origin is in the on the ischial tuberosity, and insertion is on the posterior medial condyle of tibia. Medial condyle of tibia. See, M for membrane, M for medial condyle of tibia. So this is how you remember it. Okay, just make mnemonics or find specific letters in the words okay, to remember for longer period of time. Okay, so the nerve supply is by the tibial part of the sciatic nerve. Again see, origin is same and the nerve supply is also same for both the semitendinosus and semimembranosus. Action is also same, it is a flexor of knee and extensor of hip. Okay, extensor of hip, but this is chief flexor, this is the chief, not chief, chief flexor, and this is normal. Okay, now we are going to see the biceps femoris muscle. This is biceps femoris or adductor. Oh, acha, so this is the biceps femoris. So yeah, there was disturbance. Okay, so the biceps femoris. Okay, so this is the biceps femoris muscle. Biceps 2. Okay, 2. So there is long head and short head of the biceps femoris. As in the upper limb we had the biceps brachii muscle. It had a long head and the short head. Here also again the same story, long head and short head. So origin for the long head is the ischial tuberosity, is a common origin, and for the short head it is the distal linea aspera and lateral supracondylar ridge of the femur. If you haven't seen the surface landmark video of mine in the introductory part of the lower limb, please go check that out. I'll link that out in the description box as well. So this is the biceps femoris muscle. So see, ischial tuberosity to common hai, and suppose if this is the femur, let me draw the femur. Okay, so I'm not very good at drawing when it comes to like digital drawing, but okay, I'll try. Okay, so suppose this is bad, this is very bad. Okay, so this is femur, this is the head, this is the neck, and this is the body or the shaft of the femur. So I tell you, there's this greater truncator, and see there's a line, okay, that is called the linea aspera line. So it has medial lip, this is the medial lip and the lateral lip of the linea aspera, and supracondylar ridge of the femur. So see, supracondylar ridge of the femur. So here is the supracondylar ridge, so lateral supracondylar ridge of the femur. So this is how you remember it. So distal linea aspera and lateral supracondylar ridge of the femur. So this is the short head ka origin, and okay, origin, S for short, S for supracondylar ridge. Okay, this is how you remember it, as you already see here. So see, this is the linea aspera distal part, and this is the lateral part, supracondylar lateral part. Okay, so now the insertion point of the long and short, both long and short, they become continuous with each other, and they get inserted on the head of the fibula and lateral condyle of the tibia. Okay, the lateral condyle of the tibia and the head of the fibula. We remember that fibula is the first bone, this muscle is the first muscle to get inserted okay, near the fibula. Okay, the fibula, which is the lateral bone. See, here also it is going from medial side to the lateral side and getting inserted on the fibula. So this is how you remember it. Nerve supply is by the long head. Okay, it is different for both. So long head by the tibial, short head by the common peroneal. I'm recording right? Yeah, long head by the tibial and short head by the common peroneal. See, tibial nerve, it has L4, 5, S1, 2, 3. Okay, 5 rods, and for the common peroneal we have L4, 5, S1 and 2, only 4. So this is a larger part, this is lesser part. So long head large by the tibial and short head small by the common peroneal. Okay, this is how you remember. See, anatomy is very easy if you understand. So see, long head of the tibial, long head by the tibial nerve and short head by the common peroneal. Action is again same, flexor of knee and weak extensor of hip. Okay, remember that. Okay, like this you remember it, flexor of knee and extensor of hip. Flexor, why? Because flexor compartment is present on the posterior side, and we're studying the back of the thigh. So this is very easy and very it is a thing of common sense. So biceps femoris bhi ho gaya. Now we're going to see the last muscle, that is the adductor magnus muscle. It is really a wide muscle. Okay, adductor magnus muscle. Origin is from the inferior ramus of the pubic bone to the ischial tuberosity. Okay, so see, this is the inferior ramus of the pubis and the ischial tuberosity. Okay, ischial tuberosity getting inserted on the linea aspera and adductor tubercle. So linea aspera, I already told, right, it has a line. Okay, it has a line. So this is the, let me use other color. So this is the line, and this is the lateral lip, and this is the medial lip. So medial lip of the linea aspera and the adductor tubercle. Okay, why? Because it is a adductor magnus muscle, the adductor muscle. So adductor tubercle, it is getting inserted on, and origin is on the inferior ramus of the pubic bone to the ischial tuberosity. And the nerve supply is dual nerve supply. That is why we call it as a hybrid muscle. Okay, the adductor magnus is a hybrid muscle. What is a hybrid muscle? What do you mean by hybrid muscle? It has dual nerve supply. Okay, dual nerve supply. So nerve supply, see, the adductor magnus, it has two parts, the adductor part that is on the medial side and the hamstring part that is on the posterior, the back side. So adductor part by the posterior division of the obturator nerve, and hamstring part by the tibial part of the sciatic nerve. See, most of the muscles of the back of the thigh, they are they're supplied by the tibial part of the sciatic nerve, but only one muscle by the common peroneal nerve, that is the biceps femoris. Okay, short head by the common peroneal, baki sab to tibial hai, ye bhi tibial hai. Which part? The hamstring part. And for the adductor part, we have the posterior division of the obturator nerve. Okay, because the medial side is also called as the adductor compartment or the obturator compartment. So the posterior division of the obturator for the adductor compartment part, and for the hamstring part we have the tibial part of the sciatic nerve. And the action of this muscle, that is the adductor part, is of course the adduction of the thigh. Naam mein hi hai, please try to understand. Adductor for adduction of the thigh, and for hamstring, the hamstring part, we have the flexion of the knee and extension of hip. So this is common for all the muscles of the back, okay, muscles of the back of the thigh, not muscles of back. Okay, so see, we saw how many muscles: semitendinosus, semimembranosus, biceps femoris, and adductor magnus. So for the semitendinosus, we have nerve supply by the tibial nerve, and action is the same: flexion at the knee joint and extension at the hip joint. Okay. For semimembranosus, again the tibial nerve, and again flexion at knee joint, extension at hip joint. Okay, weak extensor. Okay, for the biceps femoris, we have two. Okay, two nerve not two nerve supplies. Okay, so by the tibial nerve, long head by the tibial nerve, and short head by the common peroneal nerve. And again action is flexion at the knee joint and extension at the hip joint. And for the adductor magnus, the hybrid muscle, two nerve supply for a single muscle. Okay, so that is by the adductor compartment by the posterior division of the obturator nerve, and for the hamstring part, again we have the tibial nerve. The only nerve supplied by the common peroneal is the biceps femoris. Okay, the biceps femoris. So this is the whole summary of the chapter. The common origin is the ischial tuberosity. We saw here also ischial tuberosity. यहाँ पे भी ischial tuberosity है, but short head of this is by the linea aspera and lateral condylar ridge, and again ischial tuberosity and pubic ramus. So and insertion of the muscle that is on the fibula is the biceps femoris muscle. Okay, biceps femoris muscle, remember this. So thank you for watching. In the next video we will start with the new chapter. So abhi back of the thigh bhi complete ho gaya, so we are going to start front of the leg, dorsum of foot, and then medial side of foot, leg, medial side of leg, lateral side of leg, back side of the leg, and again sole of the foot, arches of the foot, and then we are done with the chapter. We'll try to complete it very soon. So thank you so much.